But what is happening during that time is a turmoil, emotional, mental, also spiritual, not to mention physical, of course, physical as well. So it is so important that we talk about this, that we talk about these topics. And you mentioned one thing about this lady that she remembered her previous surgery and what kind of effect this had on her. But any kind of trauma from the past have an impact on the physical body now. Can we talk a bit why it is so important to heal or treat any kind of trauma, especially when we're talking about physical injury? So something that potentially it's not connected, right, from the past, but potentially actually has a big impact on how the body reacts.
We don't have just a physical injury because we are not just a body.
Yes.
Some people say that we're a body, we're a soul, we're a spirit, and if we talk about our soul, that's the part that feels, that has a will, that thinks and things like that. So you go home with a cast. What does this mean for 3 weeks? You can't walk. You can't make your own coffee. You can't brush your teeth right. I mean, what does this mean in terms of changes in your immediate lifestyle, things that you can do or you can't do? I broke a rib a year ago, almost a simple rib, fell down the stairs. I could not get in and out of bed for 6 weeks. My husband had to put me into and out of bed. Now, what does that do for a person who's as independent as I am, who has all these things that I love doing? You want to sleep, 3 o'clock in the morning. Hey, honey, I got to go to the bathroom. It's like, this is not the way things go. So it's not just a physical injury. And I often talk about the doctor who lives inside. I have this book that says The Folks Who Lives Inside. It's not, the name isn't as good in English as it is in Portuguese and Spanish, but we all have inner doctors. And I tell my doctors that if you do not convince the inner doctor of your patient, they will not follow your orders. They will not obey the treatment plan. They will not do what, you've instructed them. And I have one of my doctor, the endocrinologist, I had the thyroid cancer, 8 or 9 years ago. And so I'm always accompanied, by this doctor. She's marvelous. She's wonderful. And she's realized this. And so what does she do? She talks to her doctors, to her patients about their inner doctor. Did I convince your inner doctor that you really do need to get off of sugar? You're diabetic. You really do need to do this. Or once I went to another dermatologist and I had some really, serious face issues, which I had never had, stuff like pimples and stuff like that you have when you're adolescent. I had never had these things. And it was fairly recently. And I went to the doctor and she says, well, we're going to do 3 months of antibiotics. And I said, how come? Oh, because you have this, that, and the other. And I went home and I looked at that prescription and my inner doctor looked at that prescription. And my inner doctor says, we're not going to take this. And I said, no, we're not going to take this. We're going to do something else, but we're not going to take 3 months of antibiotics. We're going to figure something else out. And we figured something else out, but, I did something else, but we didn't take it, And so sometimes people don't understand the power of our inner doctors. Sometimes it's people can call this our intuition. Sometimes people they submit themselves to certain kinds of treatments because this is what it's supposed to be. The doctors say so, but their intuition, their body says, I don't think so. And other times they are so convinced this is the right thing to do that they get better above and beyond anything anybody had thought or imagined for them. So we are not just physical bodies. We have feelings. We have emotional pain. If all of a sudden you can't do what you used to be able to do, if you slowly begin to notice that your memory is slipping and you have a history of Alzheimer's in your family, how do you deal with this? It's not just a brain that's kind of kicking the bucket. No, it's my whole life. It's what I've done. Even if it's temporary, you break a leg and you put it back together again and it works fine. The body says, I don't forget. I do not forget. I do not forget.
Absolutely.
And if something else comes up like it and triggers it, it says, the sky is falling, the sky is falling, the sky is falling.
Yes.
I mean, that was very clear to me. I had thyroid surgery. My first surgery, I was 15 years old. I still lived in the United States. I had a benign tumor in my thyroid, and back then, they had to cut you open to find out if it was the bad stuff, the bad thing, because everybody died of cancer back then. And so, oh my goodness, but, praise God, I didn't have it. But at 59, I did. And when the doctors told me, you're going to have surgery, I said, okay. And I went home and I freaked out.
Mm-hmm.
I freaked out, not so much because I had cancer, because I knew it was a very treatable cancer. It had been caught very early. I didn't really think I was going to die. All of a sudden, I realized the surgery that awaited me, because I had had that surgery before. I knew very well what I was going to have to go through for the next months and stuff. It was worse than the first one, because I also had to go off medication and things like that. I went to I went to a therapist and had 2, 3, 4 sessions to get my 15-year-old child inside of me, who had been operated on. I had to calm her down. Said, we're not going to die from this. This is going to be okay. In order to be able to face the surgery that I did need to do at an older age. So I think we need to take those things into consideration. We have a lot of roles inside of us. We have a lot of, I call them people, but they're not really people as such. We have different, we have pain, we have memories, we have doctors, we have some 15-year-old kids who, sometimes are rebellious. We have a scaredy cat that's 5 years old. We have a 2-year-old that still wants to sleep with her teddy bear. There was a football, soccer, sou brasileira, I'm Brazilian. So there was a soccer player from Uruguay, I think it was. And once he bit off the ear of his opponent. This was public, it was in the newspapers. Can you imagine? He bit off the ear of his opponent because he got mad at him. And I just turned to my husband and I said, he may be 28 years old on paper, but he just acted like a 2-year-old.
Yes.
I mean, he could not control his anger. And this is why people sometimes don't realize why they can't control the emotional aspects, even to the point of not being able to follow through on treatment, diets, things that people need to do for physical, medical, health reasons. But somebody inside says, I ain't doing this. I am not going to do this. Not this way, not now. So we have to do some negotiating inside in order to be able to do what we need to be able to do.
Absolutely. Now, when we are talking about trauma, any kind of trauma, it can be physical trauma, it can be an accident, it can be trauma from childhood. Let's go into EMDR. So what is actually EMDR and how it works, and how is this connected to trauma?